So good morning, Dr. Dwaihy-Logan. Thank you so much for joining us to talk to our upper schoolers today and share your wisdom on all things COVID. So I'm going to make you the host and let you take over.
Great. Thank you so much for having me, Nurse Rachel and Mr. Dunn. I really appreciate being here. I'm super excited to talk to you all today about some things that you can do to protect yourself and your friends and your family members during the pandemic. Like Nurse Rachel mentioned, my name is Renee Dwaihy-Logan. Some of you may know me or have children who know my children. One of my claims to fame at Liggett is that I'm the mom of Allison. She is now a 5th grader in the lower school, and Gracie, she is now a 1st grader in the lower school. But my bigger claim to fame is that I'm Mr. Dwaihy's sister. So that's the Dwaihy part of my name. And I know a lot of you in the upper school know about Mr. Dwaihy, Coach Dwaihy, and so he's my brother and he's my best friend. So I'm really proud of him, proud to be a sister, and I know you guys all have a lot of fun with him at school. I am also a physician and I work in a field called internal medicine. What that means is that I'm an expert in adult medicine, and I actually work downtown at Wayne School of Medicine at the medical school, both teaching residents and medical students and also taking care of patients. So one of my real exciting parts of my job is the ability to teach. And so I'm really honored to be here today to talk to you about some COVID related issues. Since the beginning of the pandemic, I have taken care of a lot of COVID patients. And also I've been the person at our program who was designated to take care of a lot of the doctors and medical students who got the coronavirus. And so while I'm no expert, I don't think anybody is truly an expert at COVID-19 just yet. I do have a lot of knowledge and I'm hoping to share it with you. I'm also a really proud Liggett mom. I am your #1 fangirl. I wore my shirt today to express this. And I really want to make a point here. You know, Liggett is an amazing school. We love Liggett. It is a really uniquely special school. And one of the things that's special about Liggett is that a lot of your teachers actually have children who attend Liggett. And so I think in a way that's very unique to ULS, we're really a family. And in addition to being a family at school, we're really a family as a community. And one of the things I want to emphasize to you today is the fact that we're going to protect one another just like we want to protect our own family in the context of this COVID infection. I also want to tell you that I'm really proud of you. I'm not just proud to be a Liggett mom and to have 2 children at Liggett. I'm really proud of all of you. School has been weird, okay? Is that an official term? School has been weird. Gracie keeps telling me, Mom, there's masks and plexiglass everywhere. School is weird. And I keep joking with her and saying, what's better? Weird mask plexiglass school or Zoom school? And she quickly tells me that weird plexiglass school is better. So I just want to emphasize for all of you that this weird school is better than nothing, better than no school, better than Zoom school, and it's temporary. I really want us all to think about how close the future will be where we're going to have a change in the way this virus is working through the community as soon as we launch a vaccine for it. So there is an end in sight. I'm very optimistic as a doctor, and I'm feeling really good. But I really want to focus on this family feeling, this team feeling. We're all going to work together on this. Now, the first thing I want to focus on for all of you who I know are probably between the ages of 14-ish to about 18-ish, it's a pretty decent range for upper school kids, students, young adults, as you are. And my goal today is I want to keep you safe. I want to keep your adult family members safe, particularly the adult family members who maybe have some medical problems or quite a bit older, grandparents, great aunts. And we really have to focus on keeping our teachers safe, because I think we all feel very strongly that being back, as weird as it is really something we want to stay with. We want to be back and stay back. And so these goals that we're going to talk about, keeping ourselves safe, I really want to emphasize. So the first thing I want to tell you about is the word fear on this slide. Our fears about COVID-19 or the coronavirus. I want to draw the parallel of like how we think about having a fire in our home. The thought of a fire in your house, burning your house down, destroying your stuff, injuring your family, it's so horrifying. It creates a lot of anxiety for a lot of young people and old people. But realistically, most people don't ever have a house fire. And if they do have a house fire, many house fires can be stopped or contained by techniques that we use to protect ourselves and to protect our homes. I want you to think of COVID the same way. If we let the fear overcome us, we will make poor decisions, we will feel overwhelmed, and we will be at risk. If we take it bull by the horns and say, we're going to use our knowledge and create a plan, just like we do with fire safety, and you have a plan at home, you have a ladder outside your upper window, you have fire extinguishers, all of the above. I want to create a COVID plan for you so that you don't waste your precious energy being afraid, but you focus that energy on being safe and keeping your family safe. So fear is our enemy, knowledge is our weapon. The first thing I want to tell you is, what would happen if one of you guys got COVID? I know you're thinking it. I know you're worrying about it. You've seen enough on TV and heard enough from friends and social media. You guys are at the age where we adults can't protect you anymore. My little Gracie, she's been protected. She only has tiny pieces of information, and she's hilarious about it. But you guys are starting to have a much more worldly vision about what's happening. And the fear is real in that this is a very serious virus for some people. And I want to emphasize that some has turned out to be very few. What we're seeing on the news, what we're hearing about, what we look at in terms of patients in the hospital, the reality is by the time you look at all the numbers of how many people who have had it, way less than 1% will actually have a terrible outcome from COVID, meaning that their body will become overwhelmingly sick and pass away. In terms of your age group, you guys are in the perfect spot. Most kids age 11 to 19 with COVID will have no symptoms, meaning you're going about your day, you feel fine, nothing, like literally nothing different from your normal day-to-day routine. You won't feel tired, you won't have a low-grade fever, you will have zilch. And there's a little bit of danger in that because you can possibly spread it. If you're going to reach a point where you get symptoms, there is the possibility that for the 3 days before you get those symptoms, you can spread it. So that's why we're being so careful. Some kids, not a lot. Now remember, most will have no symptoms. Some, same age group, 11 to 19, will have mild symptoms, sort of like a mild cold. And I want you to look at this person over here. She is sitting in a cuddle, sweater blanket. She got a Kleenex for her snotty nose. She's got a warm cup of tea. She doesn't feel great. She's going to stay home. She might have fever, chills, body aches, cough, and a runny nose. But she's going to be back at it in a couple days. If you look on the scale of the colds that you've had in your life, it's somewhere between the mildest and the middle. But here's something I really want you to watch for. Some patients with some young people will develop a change in their taste and in their smell. And I really want you to watch for that because it's so unique to COVID. Now, every blue moon, someone with sinusitis is like, I can't smell anything. I'm so full of boogers. I can't even smell that delicious chocolate. But with COVID, it's weird. They are not that congested. They feel essentially normal, but they're noticing that smells are weaker or absent altogether. And it would be something where you would smell something really strong, like ground coffee or peppermint, and you'd be like, I really can't smell that. Taste is the same thing. There's either a distortion of taste, meaning tastes taste different or unusual to you, or you can't taste at all. Either of those symptoms, I want you to really let your parents and your doctor know. But the rest of it is really hard to differentiate from a cold. Fever, chills, body aches, it's a cold. Very few children and young adults ages 11 to 19 will get a bad cold from COVID, along the lines of the flu. And that's why I put this picture in. This person is not this person, right? We can agree. This one's miserable. Strawberry pink nose, heavy eyes, blanket over the head. This one is miserable. patients in this situation, young people in this situation, are going to be off school a whole week and a half. They're going to be tired. It's going to be hard to get out of the bed. But again, I want to reassure you that the overwhelming majority will have nothing. Now, every blue moon, and this is going to be almost all in adults, a person can get extremely sick with an infection in the lungs that we call pneumonia, where instead of having all of the symptoms up here, the symptoms move down into the chest. These people have high fevers, shaking chills, they're coughing, they're bringing up gunk when they're coughing, and most will need to go to the hospital, but with proper care, almost all will recover within a few weeks. The adults have to be, the higher risk adults will be older, and many with other diseases, heart disease, high blood sugar that we call diabetes. But again, these people are going to end up in the hospital and need a higher level of care, and that's what we're hearing about on the news. Here's the really, really positive that I want you to all take home as you think about your parents and your grandparents and your neighbors and your teachers. The overwhelming majority will get better, and we really are learning how to take care of these patients better than we knew at the beginning. This virus is a mystery, but it's a mystery that the medical community is figuring out so fast. Okay, so now we're going to get into the meat and potatoes of what I'm going to talk about today. How does this virus spread? Well, we know that different viruses spread in different ways, and I just threw my pen cap across the room with great gusto. Sorry about that. This virus is unusual in that it's a little bit easier to spread than influenza, mostly because the world hadn't seen it up until last December. It was new to everybody. But a lot of people have this idea that if you walk out into the world, there's COVID everywhere and you're going to get it and you're helpless. That is not true. Yes, there may be COVID in a lot of places. Right now, our counts are very, very low, which is why we feel comfortable in Michigan sending us all back to school. But number one, you still have to think about everyone maybe being contagious or having a virus that they don't have symptoms from. But instead of saying to yourself, I'm helpless, what I want you to say to yourself is, I can stay safe. If you understand how this virus is spread and transmitted, you will be able to keep your risk at zero or very, very close to zero. My favorite phrase is infinitesimally low. Like if you follow these rules and your colleagues at school and friends follow these rules, you're going to be protected from the coronavirus. So how are viruses transmitted? There's a whole bunch of ways. Today, I'm only going to focus for you guys on a couple. A droplet is a fluid particle with virus in it, suspended in the air, that comes out from a cough, a sneeze, something out of your saliva or your nasal secretions. And it's sort of large, and that's why I created this sort of big drop. Droplets are so big that you can actually see them as they come flying at you in the air. When someone sneezes, you know, you get that little mist, that little cloud. Nurse Rachel, I just got a battery warning. Do you mind if I pause for 1 second and plug in?
There we go.
Good? Okay. Sorry about that, everybody. I had to charge up. So a droplet is going to be something that you can see in a misty cloud, and it is so heavy that it's actually going to fall to the ground. Gravitational forces are going to pull that little fluid droplet down to the ground in an arc around your body, the way gravity would act on a small particle. It hits the ground, it dries up, and then it becomes less of an issue when it's on the bottom of your shoe. An aerosol is a much smaller particle, and these actually sort of cling and float in the air. They're so small that gravity doesn't pull them down immediately. This is one of the things that you hear adults talking about a lot on the news. Oh my gosh, can it be transmitted through aerosol? Meaning just us talking to each other, our breath. Not necessarily a cough or a sneeze or a large particle, but just our breath and how our breath sort of clings and floats in the air. The reason I put a question mark behind aerosol is because we don't really know if COVID is transmitted via aerosol. And if it is, it's not efficient. So when we think about how is this virus spread, we really want to focus on droplet, but I'm going to talk to you about both forms. So how does contact droplet work? There's two types of droplet, contact droplet and direct droplet. Contact droplet means someone expelled one of these little droplets if you have COVID, you're kind of surrounded in COVID, your face, your neck, the upper part of your shirt, your hands, because you're coughing, sneezing, rubbing, and you're miserable because you have a cold, right? So if you have COVID and you have droplet because you sneezed on your hand, and then you have a high five or a handshake or even a fist bump, you are transmitting that droplet to another person who then takes it and self-infects into their eye, nose, or mouth. So the eye, the nose, and the mouth are where we say contact, meaning you touched it. You yourself contacted your own eyes, nose, and mouth from someone else's droplet. So you can imagine this mom out on the playground with her kids. She's right up on her kids. Somebody sneezes, it's on them. She touches her own eyes, nose, mouth. This is contact droplet. Feeding each other. I mean, obviously, we're not going to be doing this anytime soon, but even the behaviors around eating. Now, a lot of people have said, hey, we don't have to worry about food as a way to get it in you, right? But what we do have to worry about is the behaviors around when we eat. We touch each other's, I hand you this glass, I've touched the top of the glass that maybe your saliva went on, et cetera, et cetera. So it is the easiest thing in the world to protect yourself against contact droplet. If you don't touch your eyes, your nose, or your mouth, you cannot get COVID by contact droplet. It's truly the easiest way to protect yourself from that particular route of transmission. I want to give you two other little things to think about. If you are masked, one of the ways that masks work is an indirect way, not just in terms of filtering the particles from droplet and contact, but because if you go up to scratch your nose, you're going to be reminded, oh, wait a minute, there's a mask. I better not scratch my nose, wash my hands, right? If I got to scratch my nose, I'm going to go wash my hands, give it a good scratch under my mask, and then wash my hands again. The nose and the mouth are protected indirectly because you can't touch them through a mask. And if you're a glasses wearer, this is going to help remind you. But as you can see with this lady right here, she managed to pop right under those glasses. And I really want to emphasize your eyes. If you think about how likely you are to get it into your body, the eyes are the highest risk portal. Our nose gives us secretions that constantly come out and flush bacteria and viruses out. Our saliva has enzymes in it that digest food, but that also destroy virus. And there's a pH in there that's protective. And just the flow of our saliva is protective. But our eyes have this tiny little tear film. The virus gets in the eyes. The virus loves our eyes. It's Christmas morning to that virus to just climb right into our eyes. So when we talk about face touching, that's one of the big three. We're going to really focus on the big three today. Okay. Number two is direct droplet. And I put this very disgusting picture up for you guys because A, it was kind of gross and funny, and B, this is a perfect example of direct droplet. So a droplet, which we know is generated from coughing, sneezing, or loud talking, even singing can cause a droplet. It's when it goes directly into someone's eyes, nose, or mouth through the air. Now you can imagine this doesn't happen that often. I mean, someone coughing or sneezing directly into your eyes, nose, mouth, unless you are Mrs. Demchek and Mrs. O'Brien in the pre-K classroom where little kids cough onto their faces all the time, I think. This is really low risk, okay? And very easy to protect yourself from. Now is aerosol, and this is a controversial one. If we're all sitting together and we're talking, our breath, the very breath that we're breathing and speaking with at low volumes, is suspended in the air. And I kind of liked this picture because it looked like our talk clouds were overlapping a little. So if my COVID cloud in tan here overlaps with his green cloud and it's close enough, can he theoretically breathe in my COVID? Again, this is very low risk, but here's what I want to emphasize. Protecting yourself against direct droplet and aerosol, super easy. You need two things. You need a proper mask and you need 6 feet apart. This 6-foot number is not perfect. There have been all sorts of people who have questioned the 6 feet, but in reality, if we are distancing, plus I'm wearing a mask, plus you're wearing a mask, our risk goes down to close to 0, okay? We hear about masking, social distancing, and hand hygiene, but the next phase of my talk, I really want to teach you how to do it in the most practical way. Oh, I forgot this slide because, I had to put a poop emoji in here somewhere. We do know that COVID is shed in the urine and in the stool. And when they did studies in hospitals of the bathrooms of patients who had COVID, they found COVID was everywhere, all over the toilet, all over the sink handles. But what we don't know is if you can actually get it this way. But to prevent it is so, so easy. And here we have it, okay? When you go to the bathroom, if you use the bathroom and then do a thorough hand wash and make really certain that before the hand wash you haven't touched your eyes, nose, or mouth, it is impossible to get it fecal oral. So this way is probably the easiest. If you're the kind of person who sometimes forgets, try to get into the habit. I'm going to use this screen to talk about hand hygiene quickly, and then we're going to move on to the next topic, which is masks and PPE. And hand hygiene is super important because, again, remember that contact droplet. If you accidentally bring your hand up to your eye, but you just washed it, you're going to be okay. So how do we wash our hands in the middle of a pandemic? We simply do a better job. You want nice warm water, you want suds, you want to get in between your fingers and really around and underneath your nail beds. After you have finished a nice suds for about 30 seconds, and some people find that singing happy birthday twice will get them to that number without forgetting. Nice thorough rinse, dry your hands, and then turn off the faucet with the towel and open the bathroom door with the towel. That is going to protect you from picking up the viruses or any other germs that were laid down on your way into the bathroom. This is someone using alcohol hand rub. Alcohol-based hand rub at 70-ish% or higher, or this is like an alcohol-based hand wipe. These are very effective at killing COVID. COVID's a nasty little bugger in the body, but so easy to kill outside the body. The trick with an alcohol-based hand wipe or rub, so you got to get it on all the surfaces, and then you must let it dry for 30 seconds. This is where I see a lot of people making an unknown mistake, because if you hand rub and then get to your eye, but you haven't dried for 30 seconds, there could still be active virus in there. The warning I want to give you, alcohol is extremely drying to your skin. So anytime you have a choice between these two, do the wash, okay? Because if you alcohol 6 times a day, you are going to end up looking like me, Dr. Renee, with no skin left. You can't tell in this picture, but it's bad. I need a manicure. Okay, so let's talk a little bit about masks. And again, we're going to go back multiple times to our introduction information about contact droplet, direct droplet, aerosol, and a little bit of fecal oral. But again, the big 3, we're not going to touch eyes, nose, mouth. We're going to mask and distance, and we're going to do hand hygiene. Studies have shown us in the hospital, there's 3 big ways to get COVID. Inside the household, somebody else in your house has it, although the risk isn't that high. Some studies are about 15%, and we can get that down really low if somebody knows they have COVID and they're being careful. The other time is when we are healthcare providers in the hospital and we don't wear our proper personal protective equipment or PPE. And then the third time is in high density locations, bars, sports events, cruise ships. We saw those studies out of cruise ships, nursing homes, where a lot of people are tight together and they're not following the rules. So it's so easy to protect ourselves if with the combination of masks, we remember this fact. When healthcare providers were studied and how they got COVID, the highest risk period was when they were putting their mask on and off. So I want you to remember a 3-step sequence. Hand hygiene, mask on, hand hygiene again, hand hygiene, mask off, hand hygiene again. So when I put my mask on, this is a fresh one and my hands are clean. Sorry, I just stabbed myself in the eye with it, which I do at least half the time. I try to get it at least half the time. The first thing you want to do when you're putting a clean mask on, you're not worrying about over touching it like you will when you take it off. The hugest part with mask is the fit. And I'm going to illustrate this for you by pulling out Gracie's mask. I kind of put this one in the dryer and its days are numbered. This mask is too small for me. Okay, I got a big mouth and a big schnozola. I got a big nose. And so you can see that I don't have the full distance between my chin and the bridge of my nose. If I'm going to push down on the wire to make it fit perfectly around my nose, my chin is exposed. This always reminds me of like Ned in his bed from Dr. Seuss, where he pops his toes out the end and then his head fits, but then when he pulls his toes into the bed, his head pops out the top. So I often see people playing this terrible game with themselves where they're moving their mask constantly. So number 1, this mask is not fitting me properly. And number 2, once my mask is on, I don't want to touch it. I don't want to fiddle with it. I want to leave it on. Because the studies show that when healthcare workers got COVID, it was while they were taking their mask on and off. That's the high risk point. So you place your mask around the back of your ears and you seal it tight on the nose. You want a really good fit here. So really spend some time molding it to your nose and then make sure it's all the way under your chin. You'll get a little bit of air leak here, but I'm going to teach you how to work around that. Now, this is a properly fitting mask. You can also use a cloth mask. I'll give you an example of that. But I'm not a big fan of cloth masks because number one, they're quite a bit hotter than these masks. These are designed for a surgeon to be in the operating room for 8 hours. They're very breathable, they're very comfortable, and they're disposable. A cloth mask is going to be the same story, except this one I put through the dryer also, as you can tell. And this fits me better than Gracie's, but this one has no nose bar and it's super, super hot. Like I'm already ready to scream. So cloth masks really need 2, ideally 3 layers. And by the time you have all those layers, they're hot. And studies show that depending on what material you use for these, the protection of virus into the wearer could be as low as 10%. This is going to give you 70 to 80% protection, okay? These N95s are designed for Nurse Rachel. If a kid comes in her room and is having an asthma attack and coughing or throwing up, has a breathing treatment, we as lay people in the classroom as students don't need these N95s. So masks work in 2 ways. I'm sorry. So before I go into this slide, I want to go over this one final time. I've hand hygiened. I've put my clean mask on. I've fit it properly. And now I'm not going to touch it. If it gets wet, it's ruined. If it gets wet, as soon as the wet droplet gets to it, that water moisture in the mask sucks it right through to where we don't want it. I don't want to touch it. I don't want to fiddle with it. And I don't want to take it on and off if I possibly can. Because again, I'm going to say it a third time. Studies show that the highest risk time is the on-off time. Now, let's talk through the proper off. When I take this mask off, I want to consider this outer part contaminated, okay? I want to have imaginary COVID droplets all over it because if it did its job and protected those COVID droplets from coming in, when I take this mask off, I just did my hand hygiene. I'm going to very carefully around the ears without touching my nose. I'm going to pull it away from my face. Now, this is a disposable mask. So what I do at work is I just pitch it and then I put a new one on. If you have a cloth mask, you don't have that luxury. So what you have to do is consciously keep this inside part. The white part is what touched my face. So this is my clean. And this is my dirty. Imagine these polka dots as all your little COVIDs, right? So if you have to wear this mask again, find a clean area and put it down dirty side down so that you can pick it back up again and put clean side up. But this is where I want you to think about maybe having a few masks at school. One of the things I've done with my kids are at the age where all of this is very hard to retain because they're in lower school, but you guys in upper school are learning this at the same level as an adult. So I'm going to give you an example with this mask. It's kind of lavender on the outside and white on the inside. If you have 3 masks, you have 2 in your bag that are clean. You take off this one, it's dirty. You can fold it, put it in a Ziploc bag to take home to be laundered or put it out in the sunshine. And then when you wash your hands for your remasking after you eat your lunch, you put your fresh mask on. And so you're really, really reducing the risk just by having multiple masks to wear during the day. Disposable masks are easy peasy. And your parents can get these. I have these in an adult size, and I also have them in a kid size that I ordered online. And it's just so much easier, and they're definitely more comfortable. So think about that, okay? So hand hygiene, mask on, hand hygiene, mask off, carefully not touching the outer part, and then hand hygiene again. And now you can see I can eat now because my hands are clean, because even if I accidentally touch the contaminated part of my mask, I'm not worried about now bringing it into my mouth. Sound good? Okay. I want to think, do masks really work? Masks work in 3 ways. We talked about the first one a little while ago. The mask works as a reminder. Oh, I got to itch that. Oh, wait, I have a mask. I better not, right? It's a good reminder. But the 2 functional ways that the masks work are that they keep your droplets and your aerosols in. These masks, this mask is a surgical mask. This was designed for surgeons who quite literally just cut open somebody's body And now they don't want to breathe their germs into that hole. They got to do their business, take that appendix out, close things up, and keep it all clean. They don't want their surgeon air, even if they don't have a cold or any other germ. They don't want their spit. They don't want their sweat dripping into that opening. I'm sorry, I had to be a little gross. You guys are in high school, right? You can handle it. So these are great at keeping stuff in. They're going to keep your droplets and your aerosols in. But number two, here's our barrier. They're going to keep other people's droplets and aerosols out. And that's why if those aerosols and droplets are landing here, we have to think about this as the contaminated part of the mask. Okay. And the other answer is yes, masks really do work as long as you're handling them and putting them on and off properly. Now, I put a couple photos in of some of my friends at work because first of all, this is my friend Raven, and she is wearing what I just showed you. This is called an ear loop surgical mask. It's made of a waterproof cloth with multiple layers and folds. It has these elastic ear loops. And again, this is designed for surgeons. This is going to give us between 70 and 80% protection stuff going in this way. Raven has it properly behind her ears, but look at how low it is on her nose. So I wanted to point that out. It's got to be up and molded. And as the day was going on and Raven was doing multiple things, hers was scooting down. You'll also notice something here. This is the air leak that I showed you on myself. When you're wearing a properly fit surgical mask, you will get a little air leak on each side because, again, the surgeons aren't so much worried about what's coming out. They're worried about anything going forward. Now, here's my friend Natasha. Natasha has the same exact mask on, but she has one of these plastic devices that we can get easily online that actually, instead of the loop going behind Natasha's ear, it's coming all the way back onto this device. Awesome for two reasons. Number one, after you've had this on for about 12 hours, the back of your ear starts to get really, really sore and irritated. Number two, look what's happening to Natasha's fit. It's actually better here. She doesn't have as much of an air leak. So these are my favorite masks for all those reasons. These also come in a tie-back variety where there's actually string, and that's what the surgeons use actually realistically. These are the ones that come on and off fast. But again, by minimizing how often you remove it and replace it, you are minimizing your risk. Keep it on, don't touch it, don't fiddle with it. If you touch it inadvertently and you didn't realize it, just go wash your hands again. Okay. And finally, we're going to talk quickly about a face shield. This is really more for your teachers and some of your friends who might have high risk issues, any of your classmates who have any chronic medical conditions. This is a picture of me. I'm going to work welding. Just kidding. I'm not really welding. I'm just wearing that mask. This is called a face shield. And what this does is provide another whole layer of protection. So I have my tie back mask. See how this mask ties back? It doesn't go behind my ear. And so I have a really good fit here. And then I'm wearing my glasses at work to remind me. And now the face shield is an extra layer of reminder. Okay, so I'm going to show you guys a funny, quick video. Number one, so that you can laugh for a second. And number two, because I really want to show you a point that I think is going to create a good take home for you.
First, keep your hands clean. Today, start working on not touching your face because viruses spread is when you touch your own mouth, nose, or eyes.
I've been looking around the room here. I can't tell you the number of you put your hands to your face in the last 20 minutes or half an hour.
Washing your hands and not touching your mouth and your nose and your eyes.
The common sense of washing your hands, not touching your face.
Traditional rules of public health apply here. Just be smart.
Okay, guys, so I hope that was a little bit of laughter, but I also wanted to point something out in that video. Even though we know what to do, it's really hard to remember. These guys are experts, right? These are our national experts, and they're touching their faces left and right. And I'm sure you guys have noticed me touching my face repeatedly. I'm touching my face because I'm at home. Nobody's here with me. My hands are clean. And this is what I call my face touching vacation, because when I'm at work, I can't ever touch my face. But the average person touches their face sometimes, probably around 32% of the time. And that's just normal nature. We itch, we scratch, we have a feeling that we have to mess with, right? So I really want to go back to that point that I made about us being a family and being a team. There is nothing wrong with noticing, like my friend Raven, whose mask was slipping. I can say to her, hey, Raven, you're starting to slip here. She doesn't have to take that as me being critical of her or saying something negative. I'm trying to protect her. I love Raven. I don't want her to get COVID. And when you think about it that way and you say it in a very gentle and loving way to a friend, hey, buddy, your mask is starting to slide. If we can police each other and help each other, we're going to be able to protect one another, okay? So the take-home points, the big three: wearing that mask, hand hygiene, and avoiding touching our faces. There's a couple more things I want to talk to you about, and then we're going to wrap up. The first thing is with regards to how this infection is transmitted. We know that the highest rates are in a household. If somebody with COVID is in a household, and obviously if somebody at school gets sick or has a sick sibling, we're going to have a protocol for how many days you have to stay home before you can return. But any area where people congregate, bars, sports activities, and I know you guys are not at the bar age yet, but you are at the age where there are social experiences going on outside of school. And sometimes when those social experiences are more relaxed, some of these rules will fall by the wayside. Here's what I want to encourage you, especially while it's nice outside. If you are just dying to be with your friends because it's been a really long time, the school has set out very clear policies about how to do it safely in terms of cohorts and pods. But here's something really important. The outdoors is your friend. My mom always used to have this expression, and I think she used it when my dad would use the bathroom and she'd open the door up and open the windows. The solution to pollution is dilution. So if you think about COVID particles in the air in a certain number, we'll call that number X because my brother is Mr. Dwaihy, the math teacher, and we're in a closed space and we're close together. If those COVID particles have a space of Y to be in, you're more likely to have one of those particles get to where you don't want it, right? But if you increase that space, X is going to stay the same. I'm going to shed the same amount of virus, but now I have the great outdoors to spread it out into. And now suddenly Y times a million makes the risk of X getting to one of these locations much, much lower. I'm sure there's some algebra there. I'm sure my brother will criticize that heavily. Have fun with it, David. Okay, so thinking smart about it's fall, it's football season, people go up to colleges on the weekends and get together with their friends. These are the situations where virus is going to run wild and see its greatest opportunity. It loves people close up. It loves people disinhibited, talking loud right up in each other's face without masks. That is COVID's dream. And it's so easy to protect yourself and your family. And one extra layer to add is in those social situations, try to use the outdoors to the extent that you can. Okay. The final 2 points I wanted to mention to you are ways to keep your immune system as strong as possible so that if you or one of your relatives did get the infection. And vitamin D is a supplement that many people take. I don't want to give you official or unofficial medical advice, but I want you to ask your doctor about a vitamin D supplement. And I really, really want to encourage you, if it's safe to do so, for you to get your flu shot. This is the year that getting a vaccine against influenza, there's probably some direct effect that protects against COVID, because every time we get a vaccine, our immune system lifts, it becomes stronger, and then it kind of floats there for a while. And then, of course, influenza and COVID can act a lot alike. So it's going to be really important that if you do end up with a fever and body aches, that your doctor knows that if you've had your flu shot, it's actually much less likely to be flu and more likely to be COVID. Also, it would be very, very serious if somebody were to get COVID and influenza together, which we worry might actually happen. So again, not to scare you, but the flu shot takes that whole thing out of the equation for a good percentage. So my final point is, we are a family, we are a team. Let's act like it and really take care of one another and do all of these things and try to do them consistently, because of how much we care about one another. We care about our teachers who are maybe a little older or have medical problems who are higher risk. We care about each other's parents and aunts and uncles and grandparents. And my final point is, if you have any questions at all, I'm so happy to take the time to answer them. Mention it to your teacher. And if your teachers can write them down for me, I already talked to Nurse Rachel and Mr. Dunn about having a way so that those questions can be emailed to me, and then I'll email the responses. And my final comment is, be safe, be well, and I'm really, really looking forward to a lot of hugs and high fives when this is all over.